Pregnancy is an exciting yet challenging time filled with hopes and dreams for the future. But did you know that some common mistakes can put both you and your baby at risk? Many expectant mothers unknowingly engage in behaviors that could lead to serious complications. What if a simple choice today could change everything tomorrow? As we break down these 10 critical mistakes, you'll gain insights that can protect your health and your baby's well-being. Stay with us to learn what to avoid and ensure a smoother pregnancy journey. Your baby deserves the best from the very start. Number 1. Skipping prenatal appointments. Prenatal appointments are essential for monitoring both the mother's and the baby's health throughout pregnancy. Skipping these appointments can lead to missed opportunities to detect and address potential complications early. During these visits, healthcare providers check the baby's growth, heartbeat, and position, and monitor the mother's blood pressure and weight. Blood tests and ultrasounds performed at specific stages can identify conditions like gestational diabetes, preeclampsia, or potential birth defects. Regular checkups allow doctors to adjust care based on the individual needs of the mother and baby. For instance, they might recommend dietary changes, supplements like folic acid, or treatment for any emerging health concerns. Skipping appointments can lead to a lack of awareness about these issues, increasing risks during pregnancy and delivery. Even if a woman feels fine, certain conditions may not show symptoms but could still pose risks. Attending all scheduled appointments ensures both the mother's and baby's well-being is closely monitored and managed effectively, reducing the likelihood of complications during pregnancy. Number 2. Ignoring proper nutrition. Proper nutrition is crucial during pregnancy as it directly impacts the health and development of both the mother and the baby. A balanced diet provides essential nutrients like folic acid, iron, calcium, and protein, which support fetal growth, brain development, and the formation of healthy tissues. Ignoring proper nutrition can lead to nutrient deficiencies, increasing the risk of complications like low birth weight, premature birth, or neural tube defects. Pregnant women should aim to consume a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Folic acid, found in leafy greens and fortified cereals, helps prevent birth defects, while calcium supports the development of the baby's bones. Iron is essential to prevent anemia, which can cause fatigue and affect the baby's oxygen supply. Skipping meals or relying on processed, sugary, or nutrient-poor foods can lead to excessive weight gain or gestational diabetes. On the other hand, undereating or dieting during pregnancy can deprive the baby of necessary nutrients, affecting growth. Consulting a healthcare provider or nutritionist to develop a healthy meal plan ensures the right intake of nutrients. Number 3. Consuming alcohol or smoking. Consuming alcohol or smoking during pregnancy can have serious consequences for both the mother and the baby. Alcohol crosses the placenta, directly affecting the baby's development, and can lead to fetal alcohol spectrum disorders (FASD), which cause physical deformities, cognitive impairments, and behavioral issues. Even small amounts of alcohol can be harmful as there is no known safe level of consumption during pregnancy. Smoking, including exposure to secondhand smoke, is equally dangerous. Cigarettes contain harmful chemicals like nicotine and carbon monoxide, which reduce oxygen supply to the baby and can lead to complications like low birth weight, premature birth, and an increased risk of miscarriage. Smoking also raises the risk of placental problems, such as placental abruption, where the placenta separates from the uterus prematurely, endangering both mother and baby. Both alcohol and smoking increase the risk of sudden infant death syndrome (SIDS), respiratory issues, and developmental delays. Pregnant women who struggle to quit smoking or drinking should seek professional help, such as counseling or support groups. Quitting these habits early in pregnancy. Number 4. Overeating or eating for two. One of the most common misconceptions during pregnancy is the idea of eating for two. While it's true that a pregnant woman needs additional nutrients, overeating or consuming excessive calories can lead to unnecessary weight gain and related health complications. Gaining too much weight during pregnancy increases the risk of gestational diabetes, high blood pressure, and complications during labor, such as the need for a cesarean section. Instead of doubling food intake, it's important to focus on the quality of the diet. During the first trimester, most women do not need additional calories. In the second trimester, about 300 extra calories per day are generally sufficient, and in the third trimester, around 450 extra calories may be needed. These should come from nutrient-rich foods like whole grains, lean proteins, fruits, and vegetables, rather than sugary snacks or processed foods. Overeating can also lead to digestive discomforts, such as bloating, heartburn, and constipation, which are common in pregnancy. It's more beneficial to eat smaller. Frequent meals that are balanced and nutritious. Consulting a healthcare provider about appropriate weight gain. Number 5. Taking medications without consulting a doctor. During pregnancy, taking medications, whether prescription, over-the-counter, or herbal remedies without consulting a doctor can be dangerous. Some medications can cross the placenta and affect the developing baby, potentially leading to birth defects, developmental issues, or pregnancy complications. For example, certain pain relievers like ibuprofen and some antibiotics are known to be harmful during pregnancy. Medications that are safe for non-pregnant individuals may pose risks at various stages of pregnancy, particularly during the first trimester when the baby's organs are forming. Even herbal supplements, which may seem natural and harmless, can cause unintended side effects or interfere with fetal development. It is crucial for pregnant women to consult their healthcare provider before taking any medication, even for common ailments like colds, headaches, or allergies. Doctors can recommend pregnancy-safe alternatives or adjust dosages as needed. If a woman is already on medication for a pre-existing condition. Number 6. Engaging in high-impact exercises. While staying active during pregnancy is important for maintaining physical and mental health, engaging in high-impact exercises can pose risks to both the mother and the baby. High-impact activities such as running, jumping, or contact sports can increase the risk of falls, abdominal trauma, and excessive strain on joints and ligaments, which are already more vulnerable due to pregnancy-related hormonal changes. Pregnant women should avoid exercises that involve a high risk of injury or those that could cause abdominal trauma, such as skiing, horseback riding, or sports like soccer or basketball. Additionally, exercises that require lying flat on the back, particularly after the first trimester, can reduce blood flow to the baby due to the pressure exerted on major blood vessels. Instead, low-impact exercises such as walking, swimming, prenatal yoga, or stationary cycling are generally safer and highly recommended. These activities can help maintain cardiovascular health, manage weight gain, and reduce stress without placing excessive strain on the body. Number 7. Sleeping on your back after mid-pregnancy. After the midpoint of pregnancy, sleeping on your back is generally discouraged due to the increased weight of the growing baby, which can press down on the major blood vessels, such as the inferior vena cava. This vein is responsible for returning blood from the lower body to the heart. When compressed, it can reduce blood flow to the heart and the baby, potentially leading to dizziness, shortness of breath, and decreased circulation. In some cases, prolonged pressure on this vein can even increase the risk of stillbirth. Back sleeping can also cause other discomforts, such as worsening heartburn and backaches, as the extra weight exerts pressure on the spine and digestive system. The best sleeping position during pregnancy, particularly in the second and third trimesters, is on the left side. This position optimizes blood flow to the placenta and reduces pressure on internal organs. Using pillows to support the belly, hips, and between the legs can further enhance comfort and promote better sleep. Number 8. Ignoring hydration. Staying properly hydrated during pregnancy is essential for both maternal and fetal health. Increased blood volume, amniotic fluid production, and metabolic demands all contribute to a higher need for fluids. Dehydration can lead to various complications, including fatigue, headaches, constipation, and even preterm labor. It can also negatively affect the baby's development and increase the risk of neural tube defects. Pregnant women should aim to drink plenty of water throughout the day, targeting about 8 to 10 cups or more, depending on individual needs and activity levels. Signs of dehydration include dark yellow urine, dry mouth, and dizziness. It's important to listen to the body's cues and drink fluids regularly, even if not feeling particularly thirsty. In addition to water, consuming hydrating foods like fruits and vegetables can further contribute to fluid intake. Beverages like herbal teas or diluted juices can also be beneficial, but sugary drinks should be limited to avoid excessive calorie intake. Monitoring hydration is especially crucial during hot weather or physical activity, as these conditions can increase fluid loss. Number 9. Exposure to harmful chemicals. During pregnancy, exposure to harmful chemicals can pose significant risks to both the mother and the developing baby. Many substances, including household cleaners, pesticides, heavy metals, and certain beauty products, can adversely affect fetal development and lead to complications. Common household chemicals, such as those found in cleaning products, can emit volatile organic compounds, those Cs, that may cause respiratory issues or neurological effects. Pesticides, whether used indoors or in gardening, have been linked to developmental disorders and low birth weight. Pregnant women should seek to minimize exposure by using natural or eco-friendly alternatives and ensuring proper ventilation when using any chemical products. Heavy metals like lead and mercury can be particularly harmful. Lead exposure can result from old paint or plumbing, while mercury is often found in certain fish. Pregnant women should avoid high mercury fish, such as shark or swordfish, and ensure their environment is free from lead hazards. Additionally, many beauty products may contain harmful ingredients. Number 10. Excessive stress or anxiety. Excessive stress or anxiety during pregnancy can negatively impact both maternal and fetal health. High stress levels may lead to complications such as preterm birth, low birth weight, and developmental issues in the baby. Chronic stress can also exacerbate conditions like hypertension or gestational diabetes, making it essential for pregnant women to manage their stress effectively. The hormonal changes during pregnancy can amplify feelings of anxiety, making it important to recognize and address these emotions. Engaging in stress-reducing activities such as prenatal yoga, meditation, deep breathing exercises, or gentle walks can help alleviate anxiety and promote relaxation. Building a support system is equally crucial. Connecting with family, friends, or support groups provides emotional reassurance and helps alleviate feelings of isolation. Open communication with healthcare providers about stress or mental health concerns is vital, as they can offer resources, referrals, or coping strategies. Creating a calming environment at home, setting realistic expectations, and prioritizing self-care can also contribute to a healthier emotional state. Thanks for watching, and don't forget to like, share, and subscribe.